Schizophrenia is a complex mental health disorder that significantly affects how a person thinks, feels, and behaves. Often shrouded in misunderstanding and stigma, schizophrenia impacts not just those diagnosed with it, but also their loved ones and society at large. By fostering a better understanding of this condition, we can dispel harmful myths and cultivate a more compassionate approach toward individuals living with schizophrenia. What is schizophrenia? Schizophrenia is a chronic and severe mental disorder that can disrupt daily functioning, affecting areas such as cognition, emotions, and social interactions. The symptoms typically manifest in late adolescence or early adulthood, with an onset that can vary between individuals. Common symptoms include hallucinations, experiencing things that aren't there, such as hearing voices. Delusions, holding false beliefs, often of a paranoid nature, e.g., believing one is being persecuted. Disorganized thinking, inability to connect thoughts coherently, resulting in fragmented speech and behavior. Emotional flatness, a reduction in the display of emotions, leading to difficulties in social interactions. Cognitive challenges, problems with concentration, memory, and the ability to process and analyze information. Common symptoms of schizophrenia. Symptom category examples: hallucinations, hearing voices or seeing things that aren't there. Delusions, believing one has extraordinary powers or is under constant surveillance. Disorganized thinking, incoherent speech, difficulty following a conversation. Emotional symptoms, lack of emotional expression, difficulty feeling pleasure. Cognitive impairment, trouble focusing, memory issues, and poor decision-making. The myths surrounding schizophrenia. Despite advances in mental health awareness, several myths about schizophrenia persist, often perpetuated by media portrayals and societal stereotypes. Here are a few prominent misconceptions. Myth 1. People with schizophrenia are violent. Myth: individuals with schizophrenia are often portrayed as dangerous in movies and news reports, leading to a fear of them. Fact: the vast majority are not violent and are more likely to be victims of violence than perpetrators. Myth 2. Schizophrenia is the same as split personality. Myth: many confuse schizophrenia with dissociative identity disorder, formerly known as multiple personality disorder. Fact: while both involve dysfunctional thought processes, they are distinct conditions. Schizophrenia primarily affects perception of reality, while split personality involves having two or more distinct identities. Myth 3. Diagnosis is easy to determine. Myth: it's straightforward to identify schizophrenia based solely on symptoms. Fact: diagnosing schizophrenia requires a comprehensive evaluation by a trained mental health professional and can take time. Factors influencing schizophrenia. The cause of schizophrenia is not fully understood. However, research suggests that several factors might contribute to its development. Genetic predisposition. A family history of psychotic disorders can increase risk. Brain chemistry and structure. Imbalances in neurotransmitters, particularly dopamine and glutamate, may play a role in symptoms. Environmental triggers. Factors such as prenatal stress, drug use during adolescence, and exposure to viruses or malnutrition can impact brain development. Psychosocial factors. Stressful life events, social isolation, and trauma can exacerbate or trigger symptoms. The importance of early intervention. Recognizing the signs of schizophrenia early on can lead to more effective treatment and better outcomes. Early intervention can help minimize the impact of symptoms and support individuals in maintaining their everyday lives. Treatment often involves medication. Antipsychotics can help manage symptoms effectively, though adjustments may be necessary to find the optimal dosage and medication. Psychotherapy. Support from professionals, family therapy, and group therapy can help individuals cope with their experiences and develop social skills. Community support. Programs offering social services and housing support can be essential in helping individuals reintegrate into society. Cultivating compassion and understanding. As friends, family members, or simply compassionate individuals, it is crucial to create a supportive environment for those living with schizophrenia. Here's how we can foster understanding. Educate yourself and others. Dispel myths and inform your social circle about the realities of schizophrenia. Listen and support. Be there to listen openly without judgment. A supportive ear can be incredibly therapeutic for someone navigating their challenges. Encourage professional help. If you suspect a loved one is exhibiting symptoms, encourage them to seek professional help. Advocate for change. Support initiatives and efforts that aim to reduce stigma and improve mental health resources in your community. Mental illness is nothing to be ashamed of, but stigma and bias shame us all. Bill Clinton. In conclusion, understanding schizophrenia and the complexities surrounding it remains essential in cultivating a compassionate society. By debunking myths, supporting early intervention, and advocating for those affected, we can create a world where individuals with schizophrenia are treated with understanding and respect. Together, we can break down the barriers of stigma and foster a culture of empathy and care. Let's continue to advocate for those with this condition and assure them they are not alone in their journey toward recovery.